abduction, elbow flexion, forearm pronation, wrist verification, sorry, flexion, finger flexion. It helps to review your kaya mo yan here. Galing niya, pati yung leg na kasama. But that's how it should be. Guys, favor naman, can you push down the plate? Ay, nagka-space na yun. Alright, thanks. Ang galing, pati yung trunk, nag-shorten. Perfect. Okay? Yan ang extra 1 euro sa school. Ang magandang product. So, I will. Diba? You can edit this with built-in. I will show you something that you won't need to do anymore. Okay? Anong prinsipyo? Reverse, diba? Reverse and activate the muscle na ng working. If ito yung posture, if I tug on her arm, ang galing? Artista. Perfect yung response niya as in. Diba when you touch the arm and the hand, lalo? Kasi, lalo pag-pump. Easy! It's my first ever look viewing, clinical picture, perfect person. Where do I start? Kaya dyan, kayo naman sasagot niya para may clap kayo. Where do I start? Working. Where? If I can start here, where do I start? Why here? Because the synergy starts. Actually, kasama yung trunk. Pero na-activate ko naman pala. So, this will work here, okay? For example, if you don't correct this, if you don't do it line, and you keep working, ito sa happen. Sige, yung balik sa posture, at least yun. If you try to work here without fixing this, you will not be able to effectively change. So first, shift her weight. Oh, she's making me work for it too.
Stuck kayo.
I will plan to work on this body. So that's what you do. You align. Align the trunk, put the weight where it's not before. Okay? And then you work on the scapula. So I'm close to her because I'm changing her. And I want her to, because this could be a stability effort but to be stable. So when I change her, I want her to be stable because she's leaning sa akin. Okay? So scapular mo, totoo bang stiff yung scapula mo? Stiff mo siya kaayo. Okay? So first thing to do is depress the scapula.
Grabe ang kapot.
And
Huwag yan po ulo yan.
mobilize. Do you see that change there already? Okay, so I keep the depression. Make sure she's still stable. Then I start lengthening the biceps. That opens your elbow.
Elbow. Elbow dito.
Kunwari hindi pa, over naman na. I just want to show step by step ha. Elbow is lengthened. Okay, so I keep the depression of the scapula. And also get some retraction. So it's here. Okay? So, usually the most difficult part here is the ulnar deviation and the condition. So, ano lang, hinay-hinay. Then, I'm not leaving here because her clinical picture is asymmetric siya and unstable here. So, I'm staying here. So, usually, close man to. What you can do is, don't touch the palm first. Just anong tawag dito? Sinadisis. And then you can realize, still maintaining the depression. Kung pwede na, this is called propping, and in more robust terms, changing direction.
Propping and
Direction
changing
is
direction.
torso proximal, now it's torso distal. Okay? Can I borrow the mic stand to the mic, please? Here lang. So the other option is, just need this little. The other option is to you make her prop forward. So when you prop, the key is to extend the wrist. So para she will see her hand for the first time maybe in her life. Do it this way. Yan. So rather than prop, maybe this child has no experience of seeing her hand before. So you put it there. Then you know what I do sometimes? Kung medyo okay na yung elbow, I make her touch. They turn away because they don't know it's their hand. Just last 2 days ago, I had a patient. Ganun siya. She doesn't know it's her hand. No idea whatsoever. So we've been having therapy for a year ago and she doesn't know it's her hand. Okay? So maintain the depression, extension, supination ang important, which is the most difficult. Okay? So you want that, the other option is here. To get the supination. Okay? That's how you need it. You change the direction.
Without using milk.
Yeah, and you change not just the muscles, but the brain. So you're giving the... You're giving the brain new feedback. From this, sige, imagine natin, since hindi naman kasi naman talaga, diba? Ano yung feedback ng muscle spindles and proper circulars here? Yung certain feedbacks na, diba? So when you change that, they give a new feedback. And the person learns that. And it's done repeatedly. Iba na yung image ng nakuha niya sa brain. And when you selectively move the arm, different way, hindi yung synergy, yung, what do you call that, the mapping of the arm changes in the brain. Kasi if it's synergistic, it's this one big blob of arm. When it moves separately, it's now the elbow, the shoulder, the arm, the hand, the thumb. So nagkakaroon ng map. Let's change yung, for that body map, something, schematic representation of the body in the brain, in the motor cortex. You don't want homunculus na kasi homunculus is kind of outdated. But this is the representation. Diba musicians, guitar players, and guitarists and other violinists have very big mapping of their fingers. So separate kasi yung movement, pianists, and their elbows. Pero tayo, it will change, your mapping will change based on your use. Okay? Now to the big part of inhibition. I need a small volunteer like that. This time really small. Please. Para masamayin, okay lang sa'yo. It's okay? Is it okay? I will make you pose in a very awkward way. Is it okay? And I will change you. I just need somebody to help us. Kailangan natin mag-intervons something. I want you to do this position for me. I want you to look at me first.
Kaya na yan.
Pause. Asa naman? Diretso lang, ito lang.